Gangrene. What is gangrene? This condition is the death of tissue due to an interruption of blood flow to that particular area of the body. The condition primarily affects the extremities, with the toes being more susceptible than the fingers. Risk factors involved in gangrene include: older individuals are more prone to this condition. Diabetes can cause tissue death because if your blood sugars are not adequately controlled, the elevated blood sugars eventually damage the blood vessels that supply blood to the feet and toes and cuts off the circulation. Arteriosclerosis or hardening of the arteries may also end up blocking blood flow into the toes. Blue toe syndrome, a blood clot into the foot, could cause diminished blood flow to the toes. Injury including surgery, which traumatizes the skin and underlying tissue, may cut off circulation, creating lack of circulation to the tissue. One of the protocols in foot surgery is to always make sure there is enough distance between two incisions so that the skin in between does not have its circulation cut off and thus die. Exposure to severe cold, frostbite, which can cause tissue death because extreme cold clamps closed the small vessels going into the toes. Immunosuppression may also cause tissue death because immuno-compromised patients have a higher risk of developing infection, which then cuts off circulation. Signs and symptoms of tissue death as it affects the toes: black or blue discoloration of the skin. Sometimes if there has been trauma to a toe, the black or blue discoloration may be nothing more than dry blood, but it is important for a doctor to check the toe to make sure it is only dry blood. Severe pain at the end of the toe. Feeling of numbness. The toe may also be swollen. Drainage coming from the toe. Odor, which would indicate the area is probably infected. Many people will also develop a fever and will have a feeling of not being well. Types of gangrene. Tissue death comes in different forms. Dry gangrene is characterized by dry leathery type skin, which is usually purplish to black in color. It is seen more in people who have hardening of the arteries. Generally, this type is not infected. Wet gangrene means that there is a bacterial infection. It is characterized by swelling, drainage, and possible blistering. This is considered a medical emergency and needs to be treated immediately. Gas gangrene affects deep muscle tissue that has been deprived of its blood supply either by surgery or trauma. Treatment of gangrene. As just stated, wet and gas variety of gangrene are medical emergencies and require immediate care. The dry version also requires medical attention but is usually not an acute emergency but can certainly worsen if not properly treated. Usually there will be a surgical procedure to remove the dead tissue. In addition, intravenous antibiotics will be administered to clear up any infection. Like most medical conditions, the best way to treat this condition is through prevention. Avoiding tobacco, which clamps closed your blood vessels, is a must. Avoiding exposure to cold. Diabetics need to closely monitor their blood sugars with their doctor in an effort to keep them as close to normal as possible. Many diabetics suffer from neuropathy, and so it is important they have regular foot exams to make sure there are no problems developing on their feet. If there is a wound that occurs for whatever reason, the patient should see their doctor immediately for proper treatment in an effort to avoid infection. Read the complete article at www.foot-pain-explained.com/gangrene.html